Hi, I'm Dr. Mark Spivey. Welcome to Spivey Orthopedic Clinic. I started Spivey Orthopedic Clinic back in 2005 in an attempt to get away from the big city and get back to my country roots. At that time, I had no idea how much God would bless me and this clinic. I now operate at Optum Medical Center Tatnall, which has been rated America's 100 best hospitals for joint replacement out of nearly 4,500 hospitals nationwide. Optum Medical Center Tatnall is a physician-owned hospital that specializes in orthopedic and spine surgery. Our physician-led ownership allows us to keep patients' needs as the highest priority. We treat minimal trauma at our facility. We also do not deal with large abdominal cases, which often tend to contaminate operating rooms. By specializing in orthopedics and limiting our exposure to any type of infections, we're able to maintain especially low complication rates. Our published infection rates have been some of the lowest in the country, which has led to our Health Grades America's 100 Best Hospital for Joint Replacement rating year after year. With low complication rates, Optum Medical Center Tatnall is the ideal facility to choose your orthopedic surgery.
My surgery experience and recovery has been great. The hospital and staff have been excellent, and I was well informed of what to expect.
As a small town hospital, we have luckily had very little turnover of our staff over the years. Most of the staff that you'll see at the hospital have done over 1,000 total knee replacements with me over the years. As with anything, the more you do it, the better you get. I would argue our staff is as good as any staff you will find anywhere. With well over 3,000 total knee replacements in my career, I'm excited to share that I've recently made the technological advancement to use robotic total knee replacements. I utilized the computer for years to help me with my initial 3,000 or so total knee replacements. 2 years ago, I would have said I would have never changed. However, precision and outcomes associated with robotic surgery has truly made me a better surgeon.
On August 12, 2019, Dr. Mark Spivey performed a right total knee replacement at Optum Medical Center Tatnall. I am now at 8 weeks and doing great. I've been pain-free since the day of my surgery. I was walking the next morning, again pain-free.
A total knee replacement restores the worn surfaces by removing diseased bone ends and resurfacing them with a combination of metal and plastic components. The new knee allows a natural gliding motion of the joint. Robotics, combined with a new implant, have allowed the knee to feel not only more natural but also more stable, which leads to quicker recoveries with less pain and medication requirement. Patients that have total knee replacements have a high rate of excellent outcomes, often reporting that quality of life is substantially improved after recovery. It's important to have realistic expectations for surgery. Patients have reported they still feel some discomfort with certain activities and that the knee may feel foreign. This is normal with the total knee replacement.
If required, you may need a cardiac or medical clearance based off of your medical history. 1 week prior to surgery, you will be removed from all blood thinning agents, including aspirin-related products. This should be discussed with your prescribing physician to confirm it is safe to come off of these medications. The hospital will contact you to set up a pre-registration appointment. The night prior to surgery, you shouldn't eat or drink anything after midnight. The hospital personnel will instruct you which medications you can take the night prior to surgery with a sip of water.
On the morning of surgery, you will be asked to arrive at the hospital several hours prior to surgery. During this period, you will be evaluated by multiple medical staff. You will be given the opportunity to have a nerve block performed to help with postoperative pain. The nerve block can help decrease the need for narcotic medications. Nerve blocks at this point have really progressed significantly over the years. We now use an ultrasound machine which increases efficacy and decreases associated possible complications. Our anesthesia group specializes in orthopedic cases and are a critical part of our team.
Surgery will usually last an hour. For females, a Foley catheter will be placed for comfort once you are asleep. Surgery typically consists of general anesthetic, which means you are completely put to sleep with the addition of a nerve block.
Introducing the latest in knee replacement procedures, Omnibotics, the patented robotic-assisted technology for total knee replacement. Using state-of-the-art 3D bone morphing and robotic-assisted instruments, surgeons are able to plan and execute a total knee procedure with a high level of accuracy and control. The results? A knee replacement that is precisely fit and aligned based on the unique requirements of your anatomy for a knee that feels like new. The goal of total knee replacement is to replace the damaged cartilage and bone of the knee with an implant system to restore normal and pain-free motion. The Apex knee system consists of 4 components: The top of tibia or shin bone is replaced with the tibia base plate. The end of the femur or thigh bone is replaced with the femoral component. And an articular insert is placed between the two components to function as the sliding interface. A small button is also attached to the rear of the patella or kneecap. These components work together to replicate the natural motion of a healthy knee joint. Successful knee replacement is dependent on many factors, including precise leg alignment and implant fit. With traditional knee replacement systems, surgeons relied on a set of universal cutting guides used to reshape the bones in preparation for implants. Alignment of these guides was often determined by hand using a long rod inserted into the femur. This method of aligning cuts can be imprecise, and even a skilled surgeon could be off by a few degrees. Here we see how a small shift of only 3 degrees can translate into misaligned cuts, resulting in misaligned implants. This misalignment can cause pressure points within the knee, causing additional pain and swelling, and even premature implant failure. This risky and intrusive method of alignment can be completely avoided by using OmniBotics. Now, let's compare how the OmniBotics system can overcome these implant alignment problems, assisting the surgeon with real-time information throughout the entire procedure. First, the surgeon attaches computer sensors to the upper and lower leg. Much like GPS, these sensors continuously track the leg's motion, communicating wirelessly to the workstation's camera. This allows the surgeon to preoperatively evaluate the knee's entire range of motion, guiding it through a series of flexing and rotation motions. The graph on the left records both range of motion, or leg flexion, and leg stability, a measure of the knee's side-to-side looseness. In this example, we see many horizontal bands falling outside the normal range for leg stability, indicating this patient's preoperative knee is fairly loose and unstable. Next, using a small handheld pointer that communicates wirelessly with the workstation's computer, the surgeon traces the contours of the knee joint. The computer uses this data to map the exact shape of the femur and tibia using patented OmniBotic bone morphing technology. With the data collected, the computer is able to build and display a complete 3D representation of the joint on screen. The computer automatically calculates implant sizing and alignment based on the patient's anatomy, allowing the surgeon to visualize and fine-tune how the implant will fit and function before any bone resections are performed. When the surgeon is satisfied the implants will function properly, the bone resection process begins. Based on the surgeon's plan, the robotic guide automatically rotates to the proper angle for the first cut. A handheld surgical saw is inserted into the guide and the first cut made. The robotic guide automatically advances through the remaining 4 cuts, precisely aligning the guide each time to the correct angle and location. The surgeon has complete control of every cut and can even make small adjustments to ensure the results match the surgical plan. The surgeon next reshapes the tibia. The OmniBotic system confirms the cutting guide is exactly positioned as indicated by the surgeon's plan, so the surgeon can make a single precise cut. With bone preparation completed, the surgeon will next insert and assemble the implant components securely into the knee. Finally, before the leg tracking sensors are removed and incision closed, the surgeon will once again use the OmniBotic system to quantify and confirm the patient's postoperative range of motion. Here we see the after results are consistent with a healthy and normal knee, and that alignment has successfully been achieved. Your surgeon may even share these before and after graphs with you during recovery. Most patients can expect a speedy recovery, and should closely follow the advice of their surgeon and physical therapist during the recovery period. Now, with a knee that feels like new again, you can get back to enjoying an active lifestyle with family and friends. Omnibotics. Precision you can feel. Ask your physician if you qualify for Omnibotics Total Knee Replacement. Learn more about Omnibotics by visiting our website at omnils.com.
During surgery, we use staples to close the wound. These will be removed in 2 weeks during your post-op appointment at our office. Over the years, I've tried other closure methods, but feel that staples work the best in our hands with low wound complication rates.
After surgery, your knee will have the sensation of feeling numb as a result of the nerve block. This will start to wear off over the first 24 to 48 hours. You will be given post-op pain medication to help once the nerve block wears off.
Physical therapy will consist of some early range of motion, also known as a CPM or continuous passive motion. The machine will move your knee while you're lying in bed. I've used an aggressive continuous passive motion protocol the last several years. I hold the knee at 90 degrees for 2 hours. Combined with tranexamic acid, this will strongly limit bleeding into your knee by closing the capsule down and decreasing the amount of space that your body has to bleed into that knee. I've found that this will substantially improve your range of motion to also decrease your pain.
Physical therapy will get you up twice a day after surgery and then the next morning. Discharge will typically occur after noon on the second day after surgery. You will also use the assistance of a walker to help provide stability and support. Hospitalization will depend on your long-term planning. If you plan to go home, you will stay in the hospital for 2 to 3 days. If you plan to have rehabilitation, your stay can be extended for up to 2 weeks. Rehabilitation is based off your medical history, living arrangements, and specific insurance carriers.
Upon discharge, you will be given narcotic medication to help with pain and aspirin to thin your blood. Please let us know if you're unable to take aspirin. Blood thinners are used to help decrease the risk of deep venous thrombosis or blood clots. You will also wear TED hose, a thromboembolic deterrent, which are white surgical stockings that help prevent blood clots. I recently changed to shorter calf versions instead of the longer thigh versions. These are to be worn until your first post-op visit at our office. It is important to have a good support system to help with recovery. You will need someone to drive you to and from physical therapy and post-op appointments and assist with daily living tasks.
Pain control is important after surgery. You will be started on higher dosage of pain medication following surgery. As your post-op period progresses, your pain medication dosage will drop as well. We have observed a significant decrease in narcotic consumption since we started using robotic surgery. An ice machine will be used for post-op pain as well. This machine will go home with you to help decrease pain and inflammation. Using the ice machine will limit narcotic consumption. You should take pain medication prior to your physical therapy appointment to help gain range of motion. Outpatient physical therapy will start 1 to 2 days after being discharged.
Other than normal swelling through surgery and some discomfort from the surgery, I have had no pain whatsoever.
My physical therapy has been a great help in my recovery. At 3 weeks, I had full range of motion and could bend my knee to 130 degrees.
For the first 2 weeks after your surgery, life is about your knee. I want your leg elevated most of the day. I don't want you walking heavily or sitting with your leg hanging in a dependent position for the first 2 weeks. I learned the hard way that you go slow to go fast, and I've changed significantly since early in my career. It took me probably about 1,000 total knee replacements to really start to realize this. I've now done over 3,000 total knee replacements and have learned that these surgeries need an early period of rest to get great outcomes. You need a couple of weeks of healing before you really start pushing your knee for normal daily activities. You then need to slowly progress your activity. We want slow daily progression and not big jumps in activity. I will put our results up against anyone, but following instructions is very important for this procedure.
After surgery, you may experience some short-term limitations. Numbness on the outside of the surgery knee can be expected, along with some swelling, popping, and catching, and temporary warmness. All of these are normal with a total knee replacement within the first 6 months to a year. You may have some clicking or clunking sounds. This is your artificial implants rubbing together and is also normal. Some patients complain with discomfort with kneeling. Kneeling should be avoided within the first few months. If discomfort continues, a foam pad should be utilized. Some people will never feel comfortable kneeling even once completely recovered. You will follow up with our office 2 weeks after surgery. At this appointment, you will have an x-ray and your staples will be removed. Steri strips will be placed over the incision. From 6 months to a year, you can expect some mild swelling and warmth. This is attributed to the healing phase and your body accepting the implant. During this time, the inflammation process will dissipate and you will have significant decrease in the amount of swelling and warmth that you feel. You may still feel some clunking or clinking. This is normal. If you have pain or abnormal sounds, please contact the office. Your routine care will consist of a follow-up appointment at 2 weeks, 6 weeks, 3 months, and 1 year for routine x-rays.
After 2 to 3 days, I was walker free. At my first 2-week post-surgery, the staples were removed and x-rays were taken, at which time I got an outstanding report.
It is normal to have some discomfort with weather changes during the first year. Following your total knee replacement, please do not let anyone inject or aspirate your knee without discussing it with our office. After your surgery, I recommend you wait a minimum of 6 months to have dental work. After that point, you will need to take antibiotics prior to any dental work and then 6 hours after dental work. You will receive a wallet-sized identification card showing you have an artificial knee. This may be used when traveling to prove you have retained metallic implant. We hope your implant will last 20 years. Recent studies have shown 92% survivorship at 20 years with older knee designs and older implantation techniques. Infection is dramatically decreased by using the antibiotic during surgery and a surgical suit during surgery as well. The morbidity rate is less than 0.01%. Should you experience any abnormal drainage, calf pain, or swelling down your foot, contact the office immediately. These are some of the main points I like to share with my patients. Please take time to think of any questions and I'll be back in just a few minutes.